Most families don't think about hospice until the very end, when there's no time left to plan. Let me tell you about Frank and Evelyn, a couple from Walnut Creek. Frank had late stage heart failure. His daughter Lisa was managing medications, coordinating home health visits, and barely sleeping. Every time the phone rang, her heart sank, worried it was the hospital again. When his cardiologist finally said it might be time to consider hospice, Lisa froze. To her, hospice meant giving up. But what she didn't realize was that hospice isn't about giving up. It's about changing the focus to comfort, dignity, and peace. Frank spent his final months at home surrounded by family, pain-free, and smiling as his grandkids visited every week. Lisa later told me, "I wish we'd started hospice sooner." That's the heart of today's message, why families should explore hospice earlier than they think. Hi, I'm Dale Corpus, a Senior Transition Specialist and real estate expert based in the San Francisco Bay Area. This is another episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast, where I share real stories, insights, and strategies to help families navigate senior care and housing transitions with less confusion and more compassion. Today, we're breaking down the myths and realities around hospice care, what it is, when to consider it, and how it can bring relief to both your loved one and your family. Let's dive in. First, let's clear up the biggest misconception. Hospice doesn't mean giving up. It means shifting focus from curing to caring. Hospice is specialized care for individuals with a life expectancy of 6 months or less, as certified by a doctor. It's not just for the final days or weeks. It's designed to enhance quality of life for however much time remains. Here's what it typically includes: pain and symptom management, nursing care and medication delivery, emotional and spiritual support for the whole family, equipment like hospital beds and oxygen, respite care for exhausted family caregivers, and it's covered 100% by Medicare, Medi-Cal, and most private insurance. Families often confuse hospice with home health. Here's the key difference. Home health focuses on recovery, physical therapy, wound care, medications, with a goal of improving health. Hospice focuses on comfort and dignity, managing symptoms when recovery is no longer realistic. They serve different needs, and many families transition from home health to hospice as their parents' condition changes. Knowing the distinction early helps you choose the right path at the right time. So, how do you know it might be time to consider hospice? Here are signs I've seen families overlook. 1. Frequent ER visits or hospitalizations. 2. Rapid decline in mobility, speech, or appetite. 3. Uncontrolled pain or shortness of breath. 4. More time in bed than out of it. 5. Your parent says, "I'm tired," or "I just want to be home." If any of these resonate, it doesn't mean the end is near. It means your loved one deserves more support now. Hospice can step in earlier than you think, providing comfort and dignity instead of crisis-driven care. It's completely normal for families to resist hospice. I've heard it all. It's too soon. They're still eating. We don't want to give up hope. But hospice isn't about giving up hope. It's about redefining hope. Hope for comfort. Hope for peace. Hope for more meaningful time together without medical chaos taking over every day. When you bring hospice in earlier, you give your loved one the gift of time, not less of it. Here in the Bay Area, hospice care can be provided at home, the most common option, in assisted living or memory care communities, or in dedicated hospice houses and facilities. Hospice teams often include nurses and home health aides, social workers and chaplains, volunteers who provide companionship and caregiver relief. Here's one piece families love hearing. Hospice is fully covered under Medicare or Medi-Cal. This includes medications related to the terminal condition, equipment like beds, wheelchairs, oxygen, nurse visits, and caregiver support. There's no copay, no deductible, and you can stop hospice at any time if your loved one improves. This makes hospice one of the most compassionate and financially accessible programs in healthcare. Let me share one more story that captures why starting hospice earlier matters. The Lee family from Cupertino called me after their mom, a retired teacher, was diagnosed with late-stage Parkinson's. They thought hospice was only for the final days. But after enrolling early, the hospice nurse adjusted medications to ease her tremors. A volunteer visited weekly to read books with her. Her daughters got a respite break, time to breathe, regroup, and just be daughters again. When their mom passed peacefully months later, the family said we got to be with her, not just care for her. That's the power of hospice done right. If you're considering hospice for a loved one, here's how to start. 1. Talk to your parent's doctor. Ask if they'd qualify or benefit from a hospice evaluation. 2. Request an informational visit. Most hospice providers offer free, no obligation assessments. 3. Bring the family together. Make sure everyone understands it's about comfort and dignity, not giving up. 4. Ask about transitions. Many hospice programs work directly with assisted living or home health to ensure continuity of care. Even one conversation can ease months of uncertainty. Here's what we covered today. Hospice focuses on comfort, not cure, and it's not just for the final days. 2, it's 100% covered by Medicare and Medi-Cal. 3, you can start hospice at home, in assisted living, or in a facility. 4, early hospice gives families more time to connect and less chaos to manage. If you've been wondering whether it's too soon, chances are it's actually the perfect time to learn more. This has been another episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast. If your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com. Have a quick question? DM me on Instagram at SoulByDale. And don't forget, you can also listen to the Simplify Senior Transitions podcasts on YouTube, Spotify, and Apple Podcasts. If this episode helped you understand hospice in a new light, please like, subscribe, and share it with someone who needs this message. I'm Dale Corpus, and I'll see you on the next episode.